overrun with the fake, delusional, and disingenuous. He stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, folks? Hadn't been covering COVID in quite a while, so I thought I would cover some recent events regarding the pandemic. I have been talking, to Dr. T behind the scenes, and just discussing a few things just in the field, and he said I should get back into it. So, and I've had some other listeners also telling me how much they appreciate my coverage of it. So I'm gonna go ahead and I'm gonna do that. If you guys want more of that, I'll dig into it. I kind of stepped away from it because it died off a little bit and it got a little bit complex. But I'm going to deal with what's going on here in my state locally, and then I'll discuss some of the other things that are going on kind of around the world. I don't know if I'll get into that in this one, but I'm just going to cover what's been going on here locally. We have started to retest, medical personnel in the state because of an increase that's happened as of late. And as you can see here in Arkansas Democrat Gazette, the Arkansas COVID cases jumped by 954, hospitalizations rise by 199, and I'll say that was on the 15th. In the second article, basically it says the Arkansas Department of Health recorded its 850,000th case of coronavirus on Sunday, about 27 months after the virus was first reported in the state, including in the total count of 6,850 currently active cases and 11,526 deaths and 831,597 recoveries. Okay. So we're going to take a look at some of that. Excuse me. Alrighty. Okay. All right, here's that story. And you see a nurse practitioner here, Naomi Kroom, with the vascular access team, gets her equipment ready in the hallway of one of the COVID wards at the University of Arkansas for Medical Sciences on Tuesday, July the 22nd, 2021. So this is an old photo. But for those of you who have been with me for a while, I was talking about this gear back when all of this first started. And you don't normally see this unless you got something that you're dealing with that's pretty serious. And there's some other gear that goes along with it that covers the rest of the body, the arms and whatnot. You double glove, to protect yourself and your skin if you're dealing with some of the other things that you could come into contact with. There's also a suit similar to this that also covers the entire headgear there. When we used to deal with necrotizing fasciitis, you used to have to wear that when doing surgery, and also when you had to deal with the deceased in the morgues. That is some pretty nasty stuff. If you don't know about necrotizing fasciitis, Google that and be pretty entertaining in a gruesome kind of way. Let's get on with the article here. Okay. Arkansas's count of coronavirus cases rose Wednesday by 954 cases, the largest one-day spike in almost 3 months. The number of people hospitalized with COVID-19 in the state rose by 13 to 199. The state's death toll from the virus since March 2020, as tracked by the Arkansas Department of Health, rose by 1 to 11,528. Wednesday's increase in cases was the largest in a single day since March 19th, and the first increase since that day to top 900. Most of the 1,131 cases added on March 19th were from a backlog of reports that had been faxed in by providers weeks earlier during the state's first wave of infections from the Omicron variant. Previously, the biggest one-day rise in COVID cases since March had been the 887th case, 887 cases that were added a week ago on June 8th. Okay. The average daily increase in the state's case count over a rolling 7-day period rose to 631, its highest level since the week ending March 1st. The total number of the new cases over the previous week divided by 7 had fallen on Tuesday. With new cases continuing to outpace recoveries, the number of cases in the state that were considered active rose by 352 to 7,488. The count of active cases were already at its highest level since February 24th. Wednesday's increase in hospitalized COVID-19 patients was the third daily increase in double digits even before Wednesday's increase. The count was at its highest level since March 17th. After rising the previous 2 days, the number of the state's virus patients who were on ventilators remained at 8. The number who were in intensive care which didn't change, Tuesday rose Wednesday by 6 to 26. Since the pandemic reached Arkansas, the state health department has recorded 852,229 total cases of coronavirus, of which 832,983 are considered recovered. Okay, that's that story. And I'm going to take you over to Twitter, where the other story here that deals with pretty much the same number of cases, different number of cases. Arkansas Department of Health recorded its 850,000th case of coronavirus on Sunday, about 27 months after the virus was first reported in the state, including a total count of 6,850 currently active cases, 11,526 deaths, and 831,597 recoveries. Okay, that's another story there. And let's see here. All right, here's a few of the stories that are being covered here, and some of the questions that are being asked. Okay, fun fact: why isn't the media reporting how there is not a single ICU bed available in the entire state of Arkansas? Because no, that's an old one. Take that back. All right, there's my current. Sorry. Okay, here's my current ones. All right, there's the story I just read to you. Okay. This was from the 15th. Okay, today, new cases rise to 1,000 in a single day, not seen since March. And this was 8 hours ago. So, those numbers are still rising. And you're probably asking yourself, what is the significance of this? Okay. We weren't supposed to be seeing numbers rising in any significant way until the flu season. Yet here we are in the summer, and we are seeing increases in COVID cases, hospitalizations, and we're still having some deaths. So, what does that mean? It looks like by the time the flu season gets here, because everything was pointing towards, all the data was pointing towards this being a seasonal event that we would probably be able to have some recovery time from in the summer months. But it's looking like that's not going to be the case. It's looking like by the time flu season hits, we may be surging before around about that time to before that time. If things keep going the way that they're going. I said a long time ago, you guys can go back and check my content about, dropping the face mask requirements and everybody basically going to a more relaxed posture with regard to trying to protect themselves from infection. And infection was a bad idea. But clearly we're doing it because the public, a part of the public, does not want to adhere to that due to misinformation, due to just not wanting to wear the protective gear. We still have a problem with vaccine hesitancy. As far as visitors coming into the facilities, wearing the PPE in order to come in and visit their loved ones is how can I describe it? Compliance is iffy. The gear is given out. It's worn sometimes incorrectly, most of the time incorrectly. Walking down, to rooms and whatnot, getting into the rooms, not wearing the gear, not seeing themselves as a potential threat, not to their loved ones, or spreading it to other patients. It just seems like there's a lackadaisicalness about wearing the gear, about the disease now, the virus. And it just seems like the general public is just has fatigue with the whole situation, which is going to lead to more infections and more of the same, more of what we've been seeing. Really, I mean, I don't know what what we can do to kind of solve this problem, because there's so much misinformation that's been out there. I've covered the snake oil salesmen and people who are basically misleading the public. We're seeing some of these people one of the doctors that was out, using ivermectin and other, I guess you can call them treatments, but they were not recommended treatments. She was arrested with the January 6th group of folks. So she was charged in that, and I think she got some repercussions from her treatments of patients and denial, COVID denial. I'll probably cover that as well, but it was covered today on some of the news outlets. So, all I can say is that, especially as Black folks, we are one of the groups who are most drastically affected by COVID and the variants multiple variants that are out there. A lot more people are starting to get vaccinated, but there are a lot of people who are in the woke crowd that tend to not believe in any of the science, any of the studies that have been done. Ivermectin has been debunked, several times. Even all of the studies that were put out to see if any of those treatments would be effective, and they're not. Just had a discussion with my cousin, and he's one of those folks that thinks that your diet will protect you from any ailment on the planet, and he's one of the vegetarian vegans, whatever. And I'm not knocking that in the least. Diet has a big portion of that, but studies have indicated, and I've added those in the past also, that basically all of these immune system boosters, vitamin C, vitamin D, all those things that we were given and that people are saying to get, and they're saying, well, if you can get it from the earth, then it's better. Well, there are so many other variables with regard to that. And he's talking about, meat being contaminated, vegetables being contaminated, all these things, all these excuses, all these crazy out there, suggestions, that are being, put out there to give people alternatives to doing what they're supposed to do. And I guess this is just the new age now, where people think that there is no one right answer to anything. So everybody's looking for an alternative answer to whatever the problem is. Excuse me, but sometimes that's just not what we need to do. And in this case, you need to protect yourselves. So many of us died during the waves that we have gone through over the last, since 2019. Okay. So many of us have passed. And I'll cover another study that was just released that says that if, we would have taken the protective measures and taken the vaccines, that we could have prevented thousands of deaths. But unfortunately, people have access to so much information out here and lack the ability to be able to decipher and use that information appropriately. And it's causing confusion. It's causing paralysis, to where people just can't make decisions. People just, are being frustrated and just doing their own thing, and people are losing their lives as a result. And it doesn't have to be that way. The last thing I'm going to look at with this is, I'm going to show you guys this map here. This is Johns Hopkins Coronavirus Resource Center. You can look at data from every country in the world. Okay. Right now, we don't have very much information coming out of China, but we do know that China's had a major problem over the last few months, as well as North Korea. North Korea has also sent out a distress call to the rest of the world, something that was unprecedented. They've said that they are using their own remedies to try to stem the tide against the rising tide of these infections in their country, but we don't know how. We know it's bad, but we don't know how bad it is. At one point over the last couple of months, Hong Kong, 99% of Hong Kong was infected. Since then, China has opened up, has closed like 9 provinces and opened up an area that was uninhabited, and that they had constructed a hospital and a recovery area, among other things. And you know, if you didn't recover, I guess you'd be buried there or cremated. But that's how they were dealing with the situation. But again, not much information is coming out of there. But if you look at this and you look at the infections here in the United States, we are still the top of all of the countries. In the last 28 days, we've had 2,957,869 cases. That's not, it's not small, and we still have huge red areas in major population centers all over the place. So let's look at the United States here. This is a great map for you to utilize to look at the actual numbers, because there's a drop off on reporting on the virus right now. No one's telling anybody much about it. Life is trying to get as close to normal as possible, and we're just not there yet. I mean, this map, pretty much looks like it used to look. You can see parts of Texas hugely red here. Parts of Arkansas, Louisiana, South Carolina, Florida, all these places where people are basically just denying that they're having problems. And Los Angeles, still huge numbers. But you can go down this side here on the left, tells you all of the numbers by the confirmed cases by county. Okay. You can also zoom in. You see these deeply red areas. Those are problem slots. And there's a lot of them. Memphis, Nashville, Knoxville, Charlotte, Greenville, Raleigh, all these areas around St. Louis, Chicago, close to Chicago anyway, Minneapolis, sorry, Louisville, all these areas here, San Antonio, Oklahoma City, El Paso, Phoenix, all these places, are red hot, and we're not even in flu season yet. So, it doesn't take a rocket scientist to see that this is probably potentially going to be a bad situation by the time flu season comes up. And we were hit hard. The Black community was hit hard the last time around. So do your homework and basically protect yourselves, because we are They're not telling you to basically, continue to wear masks and whatnot, but you should, especially in areas where there are high concentrations of people. Walking to the place, but if you're going in the shop, all those types of things, you need to be wearing a mask. Especially if you're in these areas, if you've had your immunizations, if you are over 50, you should get, they're recommending that you get the 5th booster. They've also made changes to where I think children under 5, I think, are being given the shots now. So without, if you listen to what is out there, what's being told, what you can get from what the information that's being given is basically indirectly they're telling you to protect yourself. Because right now politically, it's just not a good thing to recommend masks and for people to continue to protect themselves against the virus as if nothing has changed. But as you can see here, and as you can see by the numbers, we're still having problems. Okay. So I just wanted to cover that, briefly, and to give you guys a brief synopsis of what's kind of going on in the world right now. And this isn't even touching monkeypox, okay, which they think now is sexually transmitted. So, just protect yourselves. And I will try to get some more information on this. I will touch on my state just because this is where I am, and this is where I see some of the changes, happening and subtly being, pushed out there. So just to let you guys know, and older people are susceptible due to pre-existing conditions and whatnot, but that's not a guarantee that it won't affect you if you're young, if you've had it before, whatever the case may be. There's all kinds of information out here that's talking about the long-term effects of COVID, post-COVID infection, complications and whatnot. So your best bet is to try not to get it, but it's looking like if it keeps coming in ways like this, at some point, we're all going to probably get it. But if you don't have to go through that, and you don't have to potentially find out if you're going to be one of the ones who has it so bad that it basically, takes you out, then take precautions. Do everything that you can to protect yourself. Like I said, I just wanted to kind of put this out here so that you guys would have this information and know where to get this information. I will put this down in the link. And I will do my best to find other, pertinent information to try to help you guys make a decision and to protect your families, protect yourselves. And I guess I'll close it with that. You guys have a good day.